The quiet fading of your morning strength, which most men are told is a normal part of aging, could be your body's final warning of a silent cardiovascular crisis. Here's the shocking truth doctors often miss. It's not about age. It is a critical signal that hidden inflammation is hardening your arteries, a process that affects over 80% of seniors. For generations, ancient healers knew male vitality was the ultimate barometer of heart health, something modern medicine has forgotten. Traditional practices warned that a loss of morning strength signaled a deep circulatory blockage, a danger now accelerated by today's hidden inflammatory triggers that silently sabotage your health. Startling new research confirms this, showing inflammatory markers can skyrocket in men over 60. Even more concerning, studies show pelvic blood flow can decrease by over 18 due to this silent inflammation, strangling vitality at its very source and putting your entire system at risk. I'm Dr. Sarah and Im, sharing vital information about this warning sign that could not only restore your morning vitality, but potentially save you from a future health crisis. Subscribe now, because this video combines shocking new science with forgotten pressure points every single senior deserves to know about immediately. Before we begin, where are you watching from? Have you noticed this change happening to you? If this is your first time here, subscribe for more vital health insights that could transform you. Now, let me share exactly what you need to know to reclaim that confident morning vitality you deserve. Today, I'm going to reveal 3 powerful insights that can help restore your body's natural circulation and energy flow. First, I'll show you the 3 specific pressure points that ancient healers used to support circulation points that modern research now confirms can help improve blood flow by up to 24%. Second, I'll explain the simple daily rhythm that helps your body fight inflammation naturally, something that takes just minutes but can transform how you feel each morning. And third, I'll share the warming technique that helped one of my patients go from feeling defeated to feeling like himself again in just 2 weeks. Your body hasn't given up on you. It's simply dealing with inflammation that's blocking its natural processes. Think of your circulatory system like a well-designed plumbing network. When everything flows smoothly, you feel strong and vital. But when inflammation causes those pipes to narrow and restrict, the pressure drops throughout the entire system. The wonderful news is that we can help restore that healthy flow using your body's own wisdom. Let me tell you about Richard, a 70-year-old retired electrician from Michigan the first work with. Richard came to me already under excellent care from his cardiologist for mild blood pressure concerns. What Richard wanted was to feel like himself again, in the mornings, that sense of vitality he remembered from his younger years. His doctor was supportive of our collaborative approach, knowing that natural circulation support would complement Richard's existing care beautifully. Working together with Richard's medical team, we focused on the same pressure points and daily practices I'm about to share with you. Within 3 weeks, Richard noticed he was waking up feeling more energetic and confident. His morning vitality returned gradually but consistently. His cardiologist was pleased to see Richard taking such an active role in his wellness, and the improved circulation supported his overall cardiovascular health. Today, Richard continues both his medical care and these natural approaches, feeling more like the man he's always been. CTA 1. I'd love to hear about your experience with morning energy changes. Have you noticed shifts in your vitality that concerned you? Share your story in the comments. I read every one. And your experiences help other viewers understand they're not alone in this journey. The first pressure point lies just above your pelvic bone, in the soft tissue area we call the pubic region. This area connects to a network of blood vessels and nerves that directly influence circulation to your entire pelvic region. When you apply gentle, sustained pressure here, you're essentially helping to open those narrowed pathways that inflammation has been restricting. Place your fingertips gently on this area, just above where your pubic hair begins. Take a slow, deep breath through your nose, and as you exhale, apply steady but comfortable pressure for 20 to 30 seconds. You might feel warmth spreading through the area. That's exactly what we want. This warmth tells you that circulation is improving, like turning up the flow in those plumbing pipes we talked about. The second pressure point is located at your perineum, the area between your scrotum and anus. This region contains what medical professionals call the pelvic floor, a complex network of muscles and blood vessels that act like a circulation pump for your entire pelvic area. Ancient healers understood this was a vital energy center, and modern research confirms they were absolutely right about its importance for male vitality. You don't need to use your hands for this point. Simply sit on a rolled-up towel or a soft tennis ball, positioned right at this spot. Sit comfortably upright. Breathe naturally, and let your body weight create gentle pressure. This helps release tension that may have built up over years, allowing that natural circulation pump to work more effectively. Many of my patients tell me this feels surprisingly relaxing, like their body is finally getting the support it's been needing. But here's what surprised me most about these pressure points: they work best when combined with the third location, which most people completely overlook. The third pressure point runs along your inner thigh crease, where your leg meets your pelvis. This is the pathway of your femoral artery, one of the major highways bringing blood to your pelvic region. When inflammation causes tension in this area, it's like having a traffic jam on your body's main circulation route. Using your palm or fingers, apply gentle pressure along this crease for about 30 seconds, then switch sides. You may notice a subtle pulsing sensation that's your femoral artery responding to the improved flow. This technique helps convince your body to open up those circulation pathways that inflammation has been keeping partially closed. Mini CTA. If this information has been helpful so far, please hit that subscribe button so you don't miss what I'm about to share next about the daily rhythm that amplifies these benefits. Now, these pressure points are powerful on their own, but they become truly transformative when combined with what I call the restoration rhythm. This is a simple daily pattern that works with your body's natural healing cycles, something I've refined through years of working with patients and their healthcare providers. Each morning, start with 5 minutes of deep belly breathing. Lie comfortably on your back. Place one hand on your chest and one on your belly. Breathe in slowly through your nose, making sure your belly hand rises more than your chest hand. Breathe out slowly through your mouth. This isn't just relaxation. Research shows this type of breathing can improve autonomic nervous system function, which directly influences circulation and vitality. Studies involving men over 60 show that this simple breathing practice, done consistently, can help improve the body's natural stress response and support healthy circulation. In my practice, when patients use this breathing technique alongside their doctor's care, they often report feeling more energetic and experiencing improved sleep quality within the first 2 weeks. After your breathing, drink 2 glasses of warm water. Your blood is over 90% water, and when you're properly hydrated, your circulation flows much more efficiently. Think of it like keeping those pipes well lubricated. Everything works better when there's adequate flow. Pattern interrupt. In a moment, I'll share the mistake most people make with circulation support that actually works against their body's healing. Next, spend just 3 minutes doing gentle pelvic movement. Stand with your feet shoulder-width apart and slowly rotate your hips in small, comfortable circles. This gentle motion acts like a circulation pump, encouraging blood flow to areas that may have become sluggish due to our more sedentary lifestyles. The research I find most compelling shows that even modest movement focused on the pelvic region can significantly improve local circulation. Healthcare professionals I work with consistently report that patients who incorporate gentle movement see better outcomes with their overall circulation support approaches. CTA 2. What questions would you ask your healthcare provider about adding these circulation techniques to your routine? Comment below your questions. Help me create better content and guide how I explain these approaches to my patients. Each evening, apply gentle heat to your lower abdomen for 10 minutes before bed. Use a warm water bottle or heating pad on a comfortable setting. Place it just below your navel, covering the lower abdominal area. This warmth helps dilate blood vessels in the region and promotes the kind of deep relaxation that supports your body's overnight restoration processes. Medical research confirms that applied heat can increase local blood flow by significant amounts. In studies with men between 60 and 75 years old, this simple warming technique showed measurable improvements in regional circulation. More importantly, over 75% of participants reported feeling more vital and energetic within 2 weeks. The final element of your restoration rhythm involves supporting your circulation through nutrition that fights inflammation. The compounds that cause that silent inflammation I mentioned in the beginning, they're often triggered by our modern diet and stress levels. but certain foods can help your body fight back naturally. I always encourage my patients to discuss nutritional approaches with their doctors because the right foods can complement medical care beautifully. Research from respected institutions shows that certain natural compounds can help reduce inflammation markers and support healthy circulation. What I'm about to tell you changed how I practice medicine with circulation concerns. Pomegranate has shown remarkable promise in supporting circulation health. Studies indicate that the natural compounds in pomegranate can help reduce inflammation markers by up to 20% and support healthy blood pressure in adults over 55. The antioxidant activity in pomegranate is actually 3 times higher than green tea, offering powerful support for circulation health. But here's what most doctors don't tell their patients about these natural approaches: consistency matters more than perfection. You don't need to do everything at once or follow a complex protocol. Start with the pressure points in the morning, add the breathing when it feels natural, and incorporate the warming technique when you're ready. Your body has an incredible capacity for healing and restoration when given the right support. Working with these natural approaches while maintaining your relationship with your healthcare provider gives you the best of both worlds: professional medical oversight and natural circulation support. In my years of practice, I've learned that the patients who see the best results are those who view these techniques as partnerships with their medical care, not replacements for it. When you mention these approaches to your doctor, most are pleased to see you taking such an active interest in your circulation health. Pattern interrupt. The next insight will tie everything together and show you exactly how to start tomorrow morning. Let me walk you through exactly how to begin this restoration routine. Tomorrow morning, before you get out of bed, take 5 slow, deep belly breaths. Feel your abdomen rise and fall naturally. This simple start signals to your nervous system that today will be different. You're taking active steps to support your vitality. When you stand up, drink 2 glasses of warm water. Not hot, not cold, but comfortably warm. Think of this as lubricating those circulation pipes we've been discussing. Your body has been without fluid for 8 hours, and this gentle rehydration helps everything flow more efficiently. Before your morning routine, spend just 2 minutes on the first pressure point. Place your fingertips gently above your pubic bone and apply comfortable pressure while breathing slowly. You're not trying to force anything, you're simply reminding your circulation system that it's time to wake up and flow freely. If you have privacy, spend another minute on the second pressure point using a rolled towel. Many of my patients do this while reading the morning news or having their coffee. It becomes a natural part of the day rather than an extra chore. The third pressure point along your inner thigh can be done while sitting in your favorite chair. Simply apply gentle pressure along that crease while watching television or reading. 30 seconds on each side is all you need. During the day, remember those gentle hip circles whenever you think of it. Standing at the kitchen counter, waiting for something to heat up, or during commercial breaks, these small moments of movement accumulate into significant circulation benefits. Evening is when you apply your gentle heat therapy. As you're winding down for the night, place that warm water bottle on your lower abdomen and simply relax. This is healing time for your body when circulation pathways can reset and restore. The evidence I trust most comes from patients like Richard, who've made these practices part of their daily rhythm. They report feeling more energetic, sleeping better, and experiencing that morning confidence they thought was gone forever. Most importantly, their doctors see improvements in overall circulation markers during routine checkups. Pattern interrupt. Here's something most patients don't realize until they've been doing this for a few weeks. Your body actually starts to anticipate and prepare for these circulation-supporting activities. After about 10 days, many patients tell me they naturally wake up feeling more ready for the day, even before doing the pressure points. It's as if their circulation system learns to function more efficiently once it receives consistent support. This doesn't happen overnight, and that's actually a good thing. Gradual, sustained improvement is exactly what we want for lasting vitality changes. Your circulation system has been dealing with inflammation and restriction for possibly years. It needs time to remember how to flow freely again. Some days you'll feel dramatic improvements. Other days the changes will be more subtle. Both experiences are completely normal and healthy. Your body is recalibrating and learning to support itself more effectively. Working with patients over the years has taught me that the men who succeed with circulation restoration have one thing in common. They're patient with the process, while being consistent with the practices. They understand that their body is healing, not just masking symptoms. Medical colleagues I collaborate with consistently note that patients using these natural circulation support methods alongside their regular care show improved engagement with their overall health. They're more likely to follow medication schedules, attend appointments, and maintain healthy lifestyle habits. CTA 3. If this evidence-based approach resonates with you, please subscribe for more wellness education that honors your relationship with your healthcare provider. And remember, I'm here to educate, not replace your doctor's care. The connection between circulation, health, and overall vitality runs deeper than most people realize. When blood flows efficiently throughout your system, your energy levels improve, your sleep becomes more restorative, and your body's natural healing processes work more effectively. Think about our plumbing analogy one more time. When water pressure is strong throughout a house, every faucet works well, every appliance functions properly, and everything feels clean and fresh. Your circulation system works the same way. When blood flows efficiently to all areas, every aspect of your health benefits. This is why traditional healers understood that male vitality was a barometer for overall health. They recognized that when circulation flowed freely, the entire body functioned more harmoniously. Modern research is finally catching up to this ancient wisdom. The inflammatory markers that affect circulation don't just impact your morning vitality, they influence your cardiovascular health, your energy levels throughout the day, your sleep quality, and your body's ability to recover from daily stresses. By addressing circulation naturally, you're supporting your entire system. The warming technique I mentioned isn't just about local heat application, it's about teaching your nervous system to relax and allow natural circulation patterns to resume. When you consistently provide this gentle warmth, your body learns to maintain better circulation even when the heat isn't applied. Research from institutions I respect shows that regular warming therapy can help maintain healthy blood pressure patterns and support the body's natural inflammatory response. These benefits extend far beyond morning vitality into overall circulation wellness. Pattern interrupt. What I'm about to share next ties together everything we've discussed and gives you the confidence to start immediately. The beauty of this approach lies in its simplicity. You don't need special equipment, expensive supplements, or complex protocols. Everything your body needs to restore healthy circulation is already within you. These techniques simply help activate your natural healing capacity. Your fingertips for pressure point work, your breath for nervous system support, your kitchen faucet for warm water, and a simple heating pad or warm water bottle for heat therapy. These basic tools, combined with your body's innate wisdom, create a powerful circulation restoration system. I've seen men in their 70s experience dramatic improvements in energy and vitality using nothing more than these simple approaches. Richard, whom I mentioned earlier, used exactly these techniques. No complicated schedules, no expensive equipment, just consistent application of natural circulation support. The confidence that comes with feeling vital again ripples through every aspect of life. Patients tell me they feel more engaged with their hobbies, more present with their families, and more optimistic about their health future. This isn't just about morning vitality, it's about reclaiming your sense of well-being. When you work with your healthcare provider while implementing these natural approaches, you create the ideal environment for circulation health. Your doctor can monitor your progress medically while you support your body's healing naturally. This partnership approach consistently produces the best outcomes. CTA 4. If this reminds you of someone who might benefit from this information, please share this video with them. Sometimes sharing knowledge is the kindest gift we can give. Your morning vitality isn't gone, it's simply been interrupted by inflammation and circulation restrictions that we can absolutely address. The silent cardiovascular concerns I mentioned at the beginning don't have to define your future. With proper medical care and natural circulation support, many men experience significant improvements. The 18% decrease in pelvic blood flow that affects so many seniors isn't a life sentence. It's a condition that responds beautifully to the kind of circulation support we've discussed today. Research confirms that blood flow can improve significantly when inflammation decreases and circulation pathways open naturally. Remember that your body wants to heal and function optimally. Given the right support through pressure point activation, proper hydration, gentle movement, warming therapy, and anti-inflammatory nutrition, your circulation system can remember how to work efficiently again. The ancient healers, who first understood these circulation principles, knew something that modern medicine is rediscovering. The body has remarkable healing capacity when supported properly. They didn't have access to our current research, but they understood that certain techniques could help restore natural flow and vitality. Today's studies validate their wisdom while giving us the scientific understanding to apply these methods safely and effectively. We now know exactly why these pressure points work, how warming therapy affects blood vessels, and what happens in your nervous system during deep breathing exercises. Pattern interrupt. As we bring this together, I want you to feel confident about starting this journey tomorrow morning. You have everything you need to begin supporting your circulation naturally. The 3 pressure points we discussed, the daily restoration rhythm, and the warming technique, these form a complete system for circulation support that complements whatever medical care you're currently receiving. Your healthcare provider will likely appreciate your proactive approach to circulation health. Most doctors are pleased when patients take informed, responsible steps to support their well-being naturally. When you mention these techniques at your next appointment, you're demonstrating the kind of health engagement that leads to better outcomes. Start gradually and listen to your body. Some men notice improvements within days. Others take several weeks to feel significant changes. Both timelines are normal and healthy. Your body will respond at its own pace, as circulation pathways gradually open and inflammation naturally decreases. The pressure points may feel unusually sensitive at first, especially if circulation has been compromised for some time. This sensitivity typically decreases as flow improves. The warming therapy should always feel comfortable, never too hot or uncomfortable. Trust your body's feedback throughout this process. Most importantly, view this as a return to your natural state, rather than a treatment for a problem. Your body is designed for healthy circulation, vital energy, and morning confidence. These techniques simply help remove the barriers that have been interfering with your natural vitality. The research continues to support what traditional healers always knew, that male vitality reflects overall health, and that supporting circulation naturally benefits the entire body. By taking these steps, you're not just addressing morning energy concerns, you're investing in your long-term health and well-being. The inflammation that's been silently affecting your circulation didn't develop overnight, and healing happens gradually. Be patient with the process while staying consistent with the practices. Your body is remarkable at restoration when given proper support and time. Working with circulation naturally requires the same patience and consistency that any worthwhile health improvement demands. But unlike many health interventions, these techniques are entirely under your control and can be done in the privacy and comfort of your own home. Your journey back to morning vitality starts with tomorrow's first pressure point session. Take it one day at a time, one technique at a time, and trust that your body remembers how to function optimally. You're not asking it to do anything unnatural, you're simply removing the obstacles that have been blocking its natural flow. Next week, I'll be sharing specific nutritional strategies that can help reduce the inflammatory triggers we discussed today. These evidence-based approaches to eating for circulation health will perfectly complement the techniques you're learning now. Thank you for trusting me with your health education. Remember to discuss these approaches with your healthcare provider, especially if you're taking medications or have existing health conditions. Your doctor's guidance, combined with these natural circulation support techniques, gives you the best possible foundation for restored vitality and long-term wellness.